Our topic today is dementia, and if you would please introduce yourself.
My name is Dawn Platt, and I am an Alzheimer's and dementia practitioner, and I work for a senior living company called Legend Senior Living. I've been with them for about since 2008.
Okay, and Legends is building a facility here in Mansfield.
We are, and I'm very excited about that community that's going to be opening.
And I think it's going to open in November of this coming year?
We hope so.
Yeah.
We hope so.
Excellent. Okay. So I have just a few questions to ask you. First of all, can you tell me what dementia is?
Okay. Well, dementia is an umbrella term. It encompasses a lot of different diseases as well as symptoms. But it's really a disorder of the mental functions of the brain. It can be caused by disease such as Alzheimer's or frontal lobe dementia, or it can be caused by brain injury. So dementia is more of a symptom, and then it's classified into a lot of categories of diseases, the number one being Alzheimer's disease.
Okay. And so what are some of the early signs that someone would start to experience?
Okay. Well, dementia comes in 3 stages normally, in reversible and irreversible. So some of the first signs that you might see are really basic, and you might even identify with them. Sometimes I do. So forgetfulness can be one, misplacing your keys or forgetting what you came into the room for. I mean, some of the early symptoms are pretty basic. They're not real in depth.
Okay. And once they begin to manifest and you are now classified as having dementia, what are the symptoms of it?
Well, when you have dementia, it does progress, and it progresses differently in each case, so it's a little bit different. When you move into the mid stages, you start losing abilities to write checks. You might put your car keys in the freezer. You might ask a question that you just asked me 2 minutes ago. So the symptoms do increase. You might forget somebody's name, or that you recently met a friend of your son's, and you'll introduce yourself again. So they're pretty basic.
Wow, okay. And the treatment, what do they do? What's the treatment for?
Well, there are a number of treatments available. Certainly there are several medications. They're prescribed, and I'm not a doctor, but there are several medications. One of the treatments really is brain health, taking good care of your brain and exercising your brain. Diet and exercise are proven to help people, and just maintaining structure and routine in your life are really the basic treatment.
Okay. Is there anything that we can do to prevent?
Well, I don't know that there's prevention. You know, the health experts can diagnose earlier now. People are more aware and more educated, so I think that they're talking about it more often. Associations like the Alzheimer's Association are educating people more, so I think we catch it quicker. So it's really kind of being aware and talking to your doctor, and not overlooking things for a long period of time when you realize you might be forgetting things more than normal. But
is there a cause? I mean, what causes it?
Well, there are a number of causes for dementia. There's heredity, so if it runs in your family, you're increased. You may have an increased of getting Alzheimer's, excuse me. There's also factors such as high blood pressure, alcohol-induced. We see a lot of dementia come from repetitive head injuries, and those sorts of things. So there's some commonality there involved.
Okay, excellent. And the center that's coming is a treatment center, correct?
Actually, the community that will be opening, Legend Senior Living, will have assisted living as well as memory care. And so the memory care is a specialized area for folks who have Alzheimer's and dementia, all different types. And it's secured, and our staff is specially trained to help people through that process. So we're very excited to be able to open that here in Mansfield.
Excellent. Thank you so much. We appreciate you coming in and chatting with us.
My pleasure.
Okay.